BMI, why do I care? Should I? BMI, or body mass index, is a numerical value derived from your weight and height. The formula to calculate it is BMI equals height in meters to weight in kilograms. The result is then categorized into underweight, normal weight, overweight, or various classes of obesity. These categories help medical professionals make initial assessments about a person's health status based on their weight-to-height ratio. The concept of BMI, body mass index, originated in the 19th century by a Belgian mathematician named Adolphe Quetelet. The idea was to have a simple, quick way to assess whether a person has a healthy body weight in relation to their height. Over the years, BMI has been used globally as a screening tool for weight categories, though it's worth mentioning that it's not a diagnostic tool for assessing an individual's health. Does BMI mean anything? Yes, and no. BMI can give a general idea about whether you're underweight, normal weight, overweight, or obese based on your height. However, it's just a starting point and doesn't take into account other factors like muscle mass, bone density, and distribution of fat. For example, athletes may have a high BMI but low body fat. Can it help me? It can be a wake-up call. If your BMI is in the overweight or obese category, it could be an indicator that you might be at risk for certain health issues like heart disease, high blood pressure, and diabetes. However, it shouldn't be the only measure you look at. A better approach is a comprehensive health assessment through a healthcare provider. How do I know I am fat? If you're concerned about your weight, it's essential to look at multiple factors, not just BMI. Measuring your waist circumference or getting your body fat percentage checked can give you a clearer picture. Most importantly, how you feel physically and mentally matters. Are you experiencing health issues? Do you find it hard to engage in physical activities that you used to enjoy? These might be signs to take action. If you're worried about your weight, the first step is to consult a healthcare provider for a comprehensive assessment tailored to your individual needs. This could involve a range of tests and questions about your lifestyle, followed by personalized advice. Should you care about BMI? It's a mixed bag. While BMI can give you a general idea of where you stand in terms of weight categories, underweight, normal, overweight, obese, it's not the be-all end-all measurement of health. It's more like a starting point or a quick reference. The reason you might want to care is that a high BMI can correlate with a higher risk of developing health issues like heart disease, diabetes, and high blood pressure. But again, it's not a full picture of your health. How does my scale judge me? Your typical bathroom scale only measures your total body weight and doesn't distinguish between muscle, fat, water weight, or bone. So, when you step on the scale, it's just telling you your overall weight at that moment. Some more advanced scales offer features like body fat percentage and muscle mass estimation, but these are also approximations. Muscle versus fat. Muscle tissue is denser than fat tissue. This means that if you have more muscle, you might weigh more even though you appear slimmer. This is one reason why athletes and fitness enthusiasts may have higher BMIs but lower body fat percentages. If you're concerned about your weight or body composition, the best approach is to consult a healthcare provider. They can perform more accurate tests, such as DEXA scans for body composition or blood tests for other health markers. They can also guide you on how to improve your health through diet, exercise, and potentially medication. So, should you care about BMI? As a single metric, it has its limitations, but it can be a useful part of a broader health assessment. It's good to know but should be complemented by other measures and assessments for a comprehensive view of your health. Thanks for watching the American Nutrition Channel.